hill raise isometrics. So we're going to go through a progression and regression series of doing a straight leg or standing hill raise isometric. So isometric essentially means the muscle's contracting, but it's not changing the length. And we use this for a variety of different reasons. We can use it as developing tendon stiffness, to kind of getting the foot to work with the calf complex, pretty commonly described as any sort of tendon dysfunction, or someone that's coming off of like a Achilles rupture or an ankle sprain. Huge variety of injuries and disorders that we use it for. So most people, the best place to start is going to be double leg, and then with your upper extremity support. So the upper extremity support is important because it just helps you balance. You're doing your best not to lean into the wall, but we want to be structured and supported with our upper extremity. So notice that I'm not off the edge of this ledge here. If I were to drop off the ledge, it's going to put increased load or stretch in the Achilles tendon. A lot of times we're going to start people off of a level surface, and sometimes even off of a heel lift. So like I'll take a 2-pound weight here, and I put this under my heel. That never allows me to get all the way back to the ground. Because sometimes that can be irritating for certain populations. But for now, we're going to go over ground, both feet. And I'm just simply going to go up into a heel raise. And I'm trying to get toward the top if I can. But a simple rule of thumb is just trying to get off the ground by like 2 to 3 inches and hold that position. So how the progression goes is it's going to go double leg. And then you go to a stagger stance. And then you exaggerate the stagger stance even further. And as I do this, if I go to a stagger stance, I'm putting more and more weight on the leg that's forward, and the opposite leg, being my left leg, is just there to support and give me less weight into this right side. So if my feet are side by side, obviously the weight should be distributed evenly between limbs. As I stagger my limbs, when I get further forward, there's more weight going on this side, and eventually I progress to a single leg. And I'm trying to do that with my knee straight. A lot of people will go into a knee bent position. You want to keep it knee straight. So over ground, flat surface. Sometimes you're going to have a heel lift like the plate that was shown. You're going to go double leg. You're going to start with progressions of staggering your feet. Then you're going to go to single leg. Once you can go through all those, everyone's going to have different criteria for whatever you're rehabbing or whatever the intent is behind the movement. So just look at your programming notes. That should all be depicted for you. But typically what we'll do is then we'll advance to like a ledge, to where we're doing a heel floating. So my heel is now floated off the edge. And what we're trying to do is transition to like a full isotonic type loading versus the isometric. Isotonic is moving through a range of motion. So again, just to summarize, starting double leg, foot flat, going up 2 to 3 inches off the ground, holding for whatever's prescribed, then staggering your feet, then go into single leg. And some of you may skip some of these steps relative to your capacity. So if the programming says single leg heel raise isometric, you're going to go into a heel raise isometric single leg. The last piece that I want to talk about as I face the camera here is the pressure in my foot. A lot of people will roll their foot out to the side and put a lot of weight on the lateral column of the foot or the outside of the foot. You need to be mindful that you're pushing your big toe into the ground, because as you roll the weight to the outside of the foot, it changes the loading pattern and different muscle groups become active. We want to really isolate the calf complex, the Achilles complex. So by driving that big toe into the ground, that allows us to do so.